Thank you for inviting me. I'm sorry I wasn't able to come sooner, but I just wanted to have an opportunity to say a few points on what I think is important and what EU is doing related to cancer and related to health in general. Of course, I did some research before this conference about the bladder cancer, and I realized that more than 52,000 people die every year from this type of cancer. So definitely that's something that is not that well known in Brussels, in European institutions, and these kind of events are important to raise the knowledge and to raise visibility of a very important issue. Of course, when we speak about healthcare in the EU, first I have to start with the fact that it's primarily a national competence, and historically that was, let's say, an excuse not to do a lot on the European level. However, it turned out, and we realized in the last 5 to 6 years in the previous mandate of the European Parliament and the Commission, that the EU does have a role to play and that there are many problems which member states, especially the smaller ones in the area of healthcare, cannot resolve by themselves. And the big milestone there was Europe's Beating Cancer Plan. So Europe's Beating Cancer Plan is a first full-scale strategy which covers all stages and all different types of beating cancer, from research and innovation, developing of new medicines and medical devices, to early detection, prevention, treatment, and afterlife of cancer survivors. And this was also the first strategy which contained clear objectives, clear benchmarks, clear measures, and clear funding, which was definitely very important. The funding in the amount of 4 billion euros. And this actually showed that healthcare has become one of the priorities on the European level and that EU is doing something about that. Some things have already been mentioned. I think when we speak about research projects, about building capacities, about innovation, etc., it's important that we were able to determine beating cancer as one of the priority missions or missions of the Horizon program, which means that that beating cancer has become one of the real priorities in terms of research funding on the European level for research projects. And a lot of the things that have already been mentioned have been based on precisely that fact. Cases of prevention, so a lot of things that are going on the European level. When we speak about concrete things, there's a lot of things still to be done. So we are putting pressure on the European Commission to come up with new legislation on food labeling to make sure that the consumers, that all of us know what we are eating, that we know what we are consuming, that we can make informed decision about what to consume or not to consume. And in terms of prevention, this is something that is really important. Of course, we are still waiting also for the new legislation on tobacco and alcohol, and this is something that also definitely influences a lot prevention and preventive actions on the European level. In terms of treatment, I would say, that's part of Europe's Beating Cancer Plan is the weakest, because allocation and funding and organization of healthcare systems is primarily prerogative of the member states. But still, a lot of important activities are also incorporated in the Europe's Beating Cancer Plan. I would especially emphasize the comprehensive cancer centers, the building of cancer hubs on the national level, with the idea to strengthen this cooperation between different member states and to create stronger coordination on the European level. Here, what I would also like to mention, which is very important, is the cross-border healthcare. Unfortunately, cross-border healthcare is not well represented in the Europe's Beating Cancer Plan itself, but we believe that, and we are putting also pressure on the European Commission from the European Parliament, because the Commission is the one to propose new measures, is to come up with the revision of cross-border healthcare rules, which make it easier for patients who cannot get adequate treatment in their own home country to go abroad and get healthcare treatment for cancer, which is covered by their own health insurance. And the last point is afterlife of cancer survivors. Here also, I believe that Europe's Beating Cancer Plan is not ambitious enough. What we are insisting on, the European Parliament is insisting on, to incorporate the so-called right to be forgotten in all pieces of EU legislation. That means that the people who survive cancer cannot be discriminated against, for instance, when they get health insurance, when they get life insurance, when they take on loans or credits, etc. Because we think that if somebody has survived cancer, they should not be penalized and pay high premiums for insurance just just because of the fact that they survived cancer. This is something that we already incorporated in the Consumer Credits Directive, and now we are pushing that this is incorporated in all pieces of EU financial regulation. That's what is directly related to Europe's Beating Cancer Plan. In addition to that, what we are working now is the revision of the general pharmaceutical legislation and the new Critical Medicines Act on the European level. The objective of these legislations is first to reduce our dependencies on import of medicines from third countries, especially generic ones, and the second one is to create equality of access to new cancer treatments and new health treatments in general on the European level. Because currently, 46 out of 48 new oncological medicines which have been approved on the European level are available in the biggest member state, while in, for instance, Lithuania, only 3. And this kind of disparity cannot exist. This kind of postcode lottery is unacceptable. We cannot have first and second class citizens in the European Union. And for that reason, we are now pushing for joint procurement in the Critical Medicines Act, so that several member states can work together to buy medicines in order to achieve better prices, but also to get the medicines at the same time. And in the revision of the general pharmaceutical legislation, we are also imposing new provision, new legal obligation that all member states have to get new oncological treatments and new medicines in general within 1 year. So if a new drug is approved on the European level by the EMA and the European Commission, and the member state makes a request for this medicine to be provided, the pharmaceutical companies will have to provide this new medicine within 1 year. And by doing that, we are making sure that all European patients have the same possibilities of accessing new oncological treatments instead of having first and second class citizens what we have now. Additional things that have already been adopted, I would also like to mention the European Health Data Space. I was the European Parliament's main negotiator on that file. So this will make it possible for patients to have control over their health data, especially for mobile patients who travel across borders, who go to other regions to get treatment, etc. But it will also open enormous new amounts of health data for researchers, for the so-called secondary use, for better policy making, for better policy decisions, to make sure that new oncological treatments and that new medicines are developed much faster than they are now. So essentially, if you're a researcher and you want to make a research on a certain data set in another member state, you will be able to make a request to anywhere in the European Union, and when a public body determines that you fulfill the requirements, you'll be able to work on this anonymized or pseudonymized data in a secured environment and get all the findings that are important for your research. By doing that, we are making Europe a hub of health data. I would say that we are making health data as a kind of a public good, and we are making it possible that all health data across EU is systematized, structured, and made available for research and for better policy making and better policy decisions. So these are all things that are going on currently on the European level. So we are implementing the Europe's Beating Cancer Plan. We are developing new legislation to ensure equal access to new oncological medicines. We are making health data available for all patients and all researchers across the EU. And I think definitely we are making good progress in terms of beating cancer, but also in terms of having better health outcomes on the European level. One last point, however, there is one big danger in all of this, and that is the new 7-year budget proposed by the European Commission. Because under the new proposal, there is no EU for Health program anymore. So the Commission has proposed that health is incorporated under different headings of the budget, under resilience, under competitiveness, etc., without a ring-fenced EU fund for health. I'm personally strongly against that. I believe that the Parliament also is against that, because if you lose ring-fence funding specifically dedicated for healthcare, it will be very hard to get it back. And it will be much easier for that in the future, this money allocated for healthcare is redistributed for some other priority, for defense, for industry, or whatever. This is why I will strongly continue to advocate to have a separate health budget, separate EU for Health program in the EU budget, so that EU funding, health funding is protected, so that we make sure that public health is also funded from the EU budget as much as possible. For us, it is also important to include, and I'll finish with that, also all the stakeholders. Also now we are now, as I said, negotiating the revision of the general pharmaceutical legislation. And my position has been from the start that it's essential that patient groups, patient organizations, but also organizations of healthcare professionals are included in the decision making. I was pushing for that in the European Health Data Space governance. unfortunately, a lot of other political groups were against, so we're not able to get the best outcome. But for me personally, it is priority because I think without the input from stakeholders, we'll not be able to have a rational health policy and determine the right priorities on the European level. So I will continue to strongly advocate as member of European Parliament in the legislation that you're working on at the moment, that patient representatives and health professionals representatives are very strongly incorporated and they take part in the decision-making processes of the European level. So thank you very much. Thank you for giving me the floor. I will unfortunately have to leave for another health-related event, but you have my full support, and I look forward to collaborating with you together and raising visibility of this very important issue. So thank you very much.
Thank you.